Hi everyone, this is your personal child specialist Dr. Gaurav Gupta MD, coming all the way from Chandigarh, the city beautiful in India. Today I am at a very unique location. I am at Sukhna Lake, which is filled with migratory birds from all across Asia at the present point of time. Now you may ask, what does this have to do with my present episode, which will be about constipation in babies, the common cause? And if you bear with me, hopefully by the end you will understand what the connection is. So today's topic is the single most common cause of constipation in babies and possibly older kids as well. In India, especially Punjab, where I am from, milk is considered to be the most important part of a child's diet. Unfortunately, this is also the commonest cause of constipation. The proteins in milk, the casein, and the lack of fiber means that if you take a lot of milk and do not take other foodstuffs in diet, you can end up with a significant constipation. So this is it. The commonest cause of constipation in small children till the age of say 2 years is definitely too much milk in diet and a lack of other things like vegetable, fruits, salads, etc. What is the solution? Obviously, the first part is reducing milk. So how much milk should a child take? I suggest that if a child is above the age of 1 year, he should take less than 500 ml of milk in 24 hours. Yes, you heard me right. From 6 a.m. today till 6 a.m. tomorrow, just half a kilo, half a liter of milk only. He does not need any more than that. So what about older children? What are the causes of constipation in older kids? There are many causes, but again, if I can think of a single common cause, I would have to say a lack of exercise. A sedentary lifestyle, which means spending a lot of time studying, a lot of time in front of television and other screens like computers, playing mobile games, etc., is one of the most common reason why an older child is constipated. So what are the solutions for both these categories? As I said before, reduction of milk is one of the most common things. There are 3 other things that I always tell people. The first one being toilet training. Try to ensure that a child, once he is 1 to 1.5 years old, gets into the habit of passing stools early in the morning. This becomes a problem especially in school-going age when kids wake up late, parents are in a hurry, child is getting late for school. But try to ensure that a child wakes up at least 15 minutes earlier and has the time to go and pass stools or try to pass stools at least. The second, increase fluid intake. Now again, this is something that may or may not work, but definitely lack of enough fluid can aggravate constipation in children. Finally, the diet matters a lot. Many a times parents ask me how long do we need to give medicine for constipation, and I say that the medicine for constipation should probably be given for at least 3 months or so. But if you don't want the problem to recur, then the best thing would be to make changes in the child's diet so that he gets rid of constipation permanently. So what are the dietary changes? Well, for starters, as I said before, more fruits, more vegetables, more salads. This will increase the fiber consumption in the child's diet, and that will help with constipation. Along with this, juice that is extracted at home from apples can definitely help. Dates, khajur, and prunes, kishmish, you can mix them with food, when you can mix them with milk. They are an excellent way to improve constipation. And things like melon, watermelon, papaya, all these things, because they have a good amount of water and some fiber, they may also help with constipation. Before ending, what are the common cause of constipation? The most common cause in small babies is extra milk in diet. Keep it less than 500 ml. What is the most common cause of constipation in older kids? Well, one of the most common cause is a lack of exercise. And what are the 4 things that can help prevent constipation and treat it also? Number 1, reducing milk intake to less than 500 ml per day. Number 2, toilet training. Number 3, increasing the fluid intake, especially if the child does not drink enough fluid. And last but not the least, dietary changes as suggested. Now, you may ask what all of this has to do with the lake where I'm sitting. Yes, I didn't forget that. Well, in the lake in the morning, you have lots of people doing all kinds of exercises, whether it is walking, stretching, yoga, or just about anything. And if the kids can join in, I definitely feel that we can reduce the amount of constipation happening in our kids. This is Dr. Gaurav Gupta, your personal child specialist, signing off till the next time. Take care.